I'm Linda Bell, the South Carolina State epidemiologist. I got my shot today and it just feels wonderful because I understand the benefit of the vaccines in preventing disease overall. But this vaccine in particular is our greatest tool to get this pandemic under control. We in public health have been working with all the tools available for going on a year now to control the disease spread, but it is this vaccine that's going to get us out of this pandemic. Well, what I say to people who are on the fence about getting the vaccine is that I hope that they understand the safety of the vaccine. It has gone through the same research and development process as all vaccines that the Food and Drug Administration require. But I really want them to understand the benefit of this vaccine offering protection to prevent severe illness and hospitalization, and the benefit of the vaccine as compared to the risk that we're all experiencing now with possible exposure to COVID virus is just a wonderful tool so that we can prevent the ongoing spread of this disease. Well, when I think about the number of people who have already died and the potential that we're going to see many more deaths if we don't get good coverage in the population with this vaccine, it's heart-wrenching to understand that we still have months and months more of disease spread. And so the number of people who have any questions about the vaccine and the benefits, we want them to really think hard about the fact that we've got a long way to go before we can use this vaccine to prevent more deaths, to prevent more hospitalizations. And I just so strongly encourage that people take advantage of this tool so that we can get protected. In the African American population, there are several things that we understand. The first is that they're disproportionately impacted by the disease. They're being hospitalized at a higher rate. They have higher rate of underlying medical conditions that put them at increased risk. And unfortunately, we have more questions from the African American community about the safety of the vaccine. It's a message that I want the population as a whole, African Americans in particular, to understand that the vaccine is safe, the vaccine is effective, and it gives us a means, especially as the African Americans, to prevent that higher risk of disease, higher risk of hospitalizations, and higher risk of death. We do, unfortunately, have the problem with the limited supply of vaccine. So in the meantime, all the measures that we have been recommending throughout this pandemic, those personal protective measures, the things that we can all take control of, the use of a mask to prevent the exposure to the respiratory droplets that spread the virus, to practice the physical distancing, to practice the good hand hygiene, all those things are still effective and all those things are still needed. So we need to continue to practice that as long as our disease is still spreading in the community.
What's your name?
We'll see what happens.
Yeah.